acne is in most cases a fairly mild disorder, it is still highly recommended that you consult a physician before attempting to treat it yourself. There are many over-the-counter options for treating acne, most of which can be effective to at least some degree. It is tempting to just run down the corner store and purchase something based on the recommendation of a friend or a successful marketing campaign. You would be wiser thought to consult a doctor, as they can advise you on the most effective type of treatment for your particular case of acne. There are a very large number of products available to treat acne at the current time. You can always take the advice of a friend that has used a particular product, but you have to keep in mind that not all people react to medications the same and not all cases of acne are the same. There could be some significant differences between your acne and your friends. You will be better able to select the proper treatment for your situation if you have a basic knowledge of the active ingredients in the various acne medications. Benzoyl peroxide is one of the more popular active ingredients found in current acne treatments. It can be found in gels and creams and fights acne with a dual action. First, it helps treat the bacteria on the surface of the skin that actually causes pimples. Secondly, it helps to remove the dead skin cells and oils from the surface of your skin. When sebum combines with these dead skin cells, it blocks the pores and causes blackheads and whiteheads. Benzoyl peroxide has been determined to be safe in directly treating existing lesions. On clear skin, it can be used as a preventative treatment. This will help keep the acne-causing bacteria from developing on the skin. The only side effect is a tendency to cause dry skin, which can be controlled by reducing the applications. Care should also be taken because it will bleach out hair and clothes. Salicylic acid is another common ingredient in acne treatments. It works by removing the dead skin cells that accumulate and block the skin pores. Salicylic acid products need to be used even when the skin is clear to keep the acne from reoccurring. The only reported side effect is drying and irritation of the skin in some people. The two other most common ingredients are sulfur and resorcinol. Resorcinol works by removing the entire top layer of skin, which also effectively removes the dead skin cells before they can clog pores. Sulfur has been used to treat acne for over 50 years with significant success, despite the fact that it is not known how it actually helps. Sulfur is frequently mixed with other treatments to help them be more effective, but is not normally used on its own because of the unpleasant odor. Benzoyl peroxide is probably the most versatile of the above ingredients. It can safely be used in creams, lotions, gels and soaps. These products should be used several times a day directly on the pimples as well as the skin around them. Macules and scars. Before I jump into the topic of scars, I need to clarify the difference between macules and scars. Macules may look like scars, but they are not scars in the sense that a permanent change has occurred. Macules are essentially the final stage of most inflamed acne lesions. They are normally flat, reddish spots that can remain for up to 8 months. But the difference between a macule and a scar is that a macule will end up disappearing completely, whereas a scar will remain for years or indefinitely. As for scars, this can also vary from person to person. With some individuals, scars may remain for a lifetime without change, but with others, their skin will undergo a form of remodeling that will eventually diminish the scar. Another factor that needs to be evaluated is the human element of scarring. People simply have different feelings about acne scars. Those who are distressed about their acne scars are much more likely to actively seek out treatment to moderate or remove the scar than those who are more indifferent about the scars. Cause of scars. Let us first gain a better understanding of acne scars by first determining the cause of scars. A scar is a mark left in the skin by the healing of a wound or surgical incision in which the normal functional tissue, skin, is replaced by connective tissue, scar. In the case of acne, the lesion is caused by the body's inflammatory response to sebum, bacteria and dead cells that are trapped in the plugged sebaceous follicle. When your skin tissue has suffered a lesion of some sorts, your body will attempt to heal the injured site. It does so by increasing the white blood cells in the area along with an array of inflammatory molecules whose function is to repair the damaged tissue and fight infection. In the end, the repair job can be messy, and the site of the lesion is now filled with fibrous scar tissue or eroded tissue. As for the inflammatory molecules and white blood cells, they can remain at the acne lesion for days and even weeks. Take note of the fact that not everyone functions in the same way, and this holds true with our skin as well. Some people are simply more prone to scarring than others. Treatment for scars. Bear in mind that treating acne and treating acne scars are two completely different things. Treating your acne has nothing to do with treating an acne scar. Acne scars can indeed be treated, but it is important that an acne sufferer bring their acne condition under control first if they still suffer from moderate to severe acne. Once your acne subsides, make an appointment with a dermatologist and discuss the methods, if applicable, of scar treatments she recommend you undergo to treat your scars. Keep in mind that there are many methods with which you may treat your scars. These methods vary according to your scar type, size and location, type of skin, and of course, money $. All this should be discussed in great detail with your dermatologist. Before undergoing scar treatment, ask yourself the following questions before having your dermatologist undergo the decided procedures. Are you willing to wait and see if the scars will subside on their own with time? Do your acne scars affect you emotionally and socially? Is your scarring substantial enough to warrant scar treatment? Can you afford the treatment, or what treatment options can you afford? Keep in mind, the objective of scar treatment is not to necessarily rid you of all indications of scars by completely restoring your skin. It very much depends on the severity of your scars, your skin type, your skin's ability to regenerate, etc. Significant improvements can definitely be achieved, but complete restoration is often impossible. You do not have to feel bad if you looked yourself into the mirror one morning and found a disgusting-looking zit, because majority of teenagers go through this distressing condition at some point of time in their teen life. Clinical studies are evident that almost 100% of all teens have at least an occasional whitehead, blackhead or pimple. Keywords: acne medicine, acne treatment, adult acne, clear up acne, clear acne, how to clear acne scar. Article body: you do not have to feel bad if you looked yourself into the mirror one morning and found a disgusting-looking zit, because majority of teenagers go through this distressing condition at some point of time in their teen life. Clinical studies are evident that almost 100% of all teens have at least an occasional whitehead, blackhead or pimple. Several changes occur in your body and emotions while you step into adulthood because of hormone modifications. When hormones are highly active, the glands that are attached to hair follicles, sebaceous glands, produce more sebum, an oily substance that lives within the pores. An acne lesion, whitehead, blackhead or pimple, occurs when a hair follicle becomes plugged with the sebum and dead skin cells that are always being shed by the body. Brace yourself. When acne begins sometime between the ages of 10 and 13, it is usually going to go on for 5, or even 10, years. The most severe cases in some teens stem from the development of comedones. Comedones are skin-colored, small bumps that frequently show up on the forehead and chin of those with acne. Some may be so small that they are not visible to the naked eye. These are called microcomedones. The heaviest breakouts will be at their worst at about 3 to 5 years after the first comedones appear. The pimples and blackheads you're experiencing right now should disappear sometime between ages of 20 and 25. However, the most severe cases, nodular acne or cystic acne, may not resolve until you're 30 or over. Most of all, try not to isolate yourself just because you're breaking out. Take a look around you. Lots of the kids you know are also walking around with acne. Your parents probably suffered with it as well when they were adolescents. Ask them. Acne has not singled you out. Besides, you're not alone in feeling the way you do. British teenagers conducted a survey and found that they are suffering the same emotional pain that you are. Almost 40% of them have avoided going to school because they were embarrassed. Over half of them felt that acne prevented them from having a boyfriend or girlfriend. About 1/3 said it got in the way of them being able to make friends. By treating your acne properly, you can protect yourself from the emotional effects of your condition, and you can stop the breakouts from getting worse. Thanks to modern sciences, that is making the availability of medications possible.